Anh tìm nỗi nhớ, anh tìm quá khứ, nhớ lại.
Washing procedure. Wet your hands with clean, running water and apply soap. Rub hands palm to palm. Rub back of each hand with the palm of other hands with fingers interlaced. Rub back palm to palm with fingers interlaced. Rub with backs of fingers to opposite palms with fingers interlocked. Rub each thumb clasped in opposite hand using rotational movement. Rub tips of fingers in opposite palm in circular motion. Rinse hands with water. Dry thoroughly. Turn off the faucet with the tissue or towel you use to dry your hands. Before checking the vital signs, these are the different points to consider, like the following. Identify the patient. Introduce yourself with a friendly voice and establish rapport. Explain the procedure to the patient and provide privacy. Encourage the patient to relax, breathe normally and not to speak during the procedure. Taking the body temperature. Always perform proper hand hygiene or washing. Obtain the thermometer and assist the patient to a comfortable position that provide easy access. Clean and prepare the thermometer. Properly place the thermometer and leave the temperature probe in place until an audible signal indicated completion. Taking pulse rate. If the patient is supine, place his or her forearm straight alongside the body or across the lower chest or upper abdomen with the wrist extended straight. If the patient is sitting, bend the first 2 or 3 fingers over the groove along the radial side of the patient's inner wrist and lay it down in the chest area if patient is a woman and abdomen area if the patient is a male. Lightly compress the artery against the radius, obliterating the pulse initially, then ease the pressure so the pulse became easily palpable. Count the rate for a full 60 seconds and assess the pattern of irregularity. Taking respiratory rate. After observing the pulse rate, immediately proceed to take the respiratory rate of the patient. Observe to complete respiratory cycle, 1 aspiration and 1 expiration equals 1 respiratory count/rate, and observe the patient's respiratory pattern. After observing the respiratory cycle, use a watch with the second hand to assess the patient's respiratory rate by counting it for a full 1 minute. Taking blood pressure. Determine the previous baseline BP of the patient. Measure the upper extremity circumference and select the appropriate size cuff. Position the patient's forearm at the heart level support with the palm facing up. Expose the patient's arm fully by removing any constricting clothing. Do not place the cuff over the clothing. Apply the cuff above the artery 2 to 3 cm above the antecubital fossa. Wrap the dilated cuff evenly and snugly around the patient's upper arm. Place the stethoscope earpieces in the ears and make sure sounds were clear, not muffled. Turn the valve of the pressure bulb clockwise until tight, and slowly inflate the cuff above the patient's estimated palpated systolic pressure, the patient's previous documented systolic pressure. Observe the point of manometer at which the first choroid cough sound was heard, and continue to deflate the cuff gradually, and observe the point in the manometer at which all choroid sounds disappear. When the sound disappear, quickly deflate the cuff completely, and remove the cuff from the patient's arm. Use of crutches procedure. Before the procedure, there are different points to consider, like the following. Greet the client properly and establish rapport. Prepare the necessary equipment. Nursing assistant proper places at the weak side of the patient. Adjust the distance between the crutches pad and armpit. Hand the crutches properly. 2-point gait pattern. Place the crutches tip at the proper distance, 4 to 6 inches. Advance the affected foot and the opposite crutch, and advance the non-affected foot and the opposite crutch. Three-point gait pattern. Place the crutches tip at the proper distance, 4 to 6 inches. Advance the affected foot, and both crutches, and advance the non-affected foot. Maintain the crutches in place. Four-point gait pattern. Place the crutches tip at the proper distance, 4 to 6 inches. Advance the opposite crutch of the affected foot followed by the affected foot. Advance the opposite crutch of unaffected foot followed by the unaffected foot. Swing to gait pattern. Place the crutches tip at the proper distance, 4 to 6 inches. Advance both crutches tip the hop or drag forward both feet at the crutches level. Swing through gait pattern. Place the crutches tip at the proper distance, 4 to 6 inches. Advance both crutches. Lift both feet, and swing forward and land feet in front of the crutches. Going up the stairs using the crutches. Place the crutches tip at the proper distance, 4 to 6 inches. Lift first the unaffected leg, followed by the crutches, then, lift the affected leg. Going down the stairs using crutches. Place the crutches tip at the proper distance, 4 to 6 inches. Put your crutches on the step below first, one in each arm. Move your weak leg forward, and down followed by your strong leg. Standing up on the chair. Slide forward to the edge of the chair. Hold both crutches on injured side. Lean forward. Hold the chair with the other hand. Push up on the hand grip of the crutch and the arm of the chair. Sitting on the chair with crutches. Place the chair against a wall, or in a secure place, so it cannot move or slide. Back up against the chair. Put leg against the front seat of the chair. Hold the crutches at the side, and use the other hand to hold the arm of the chair. Use the good leg to lower down in the chair.